Hello, welcome to another episode of Seco Direct. I'm your host, Dr. Tiwa, and today we are going to dive into something that is very, very important in terms of public health and in terms of the impact of this disease in our community today. And it really affects the landscape of not only the youths but also older people, and also can lead to different complications as the case may be. What are we talking about? We're talking about hepatitis. We're going to talk about what it is, how it can be gotten, what should we do to prevent it, things that we need to know in terms of management or in terms of who we are going to meet, what health practitioner we are going to see regarding this particular ailment on today's episode. Please stay tuned as we break down hepatitis. So what is hepatitis? It's in the word. Hepa is liver and itis refers to an inflammation. So if we're going for a simplistic explanation of what hepatitis is basically the inflammation of liver. And we look at liver that, okay, what does liver do for our body? Liver is the biggest organ inside our body and has many crucial functions. For instance, it detoxifies our blood, it stores essential nutrients and minerals. It also helps with the production of bile, which is something that comes out when we are digesting our food or when we take in food. I'll need it to be crushed to a paste and creating a liquid, greenish liquid. That function happens in the liver. Also, things like creation of glucose that we use or creation of glycogen that we also use. All this is done in the liver. So when we talk about the itis, the hepatitis, we're talking about inflammation of a very important organ in our body. There are several types of hepatitis, several ways that our liver can be inflamed. One of the biggest and most common ones is called viral hepatitis, where there are some viral infections that affect the liver that would cause it to be inflamed. For instance, we have the hepatitis A, B, C, D, and E. We also have alcoholic hepatitis. It's in the word. This is when the inflammation is caused by consumption of alcohol. There are also some certain medications that can cause this inflammation of the liver, as well as autoimmune diseases, where the liver fights itself, causing the inflammation. Hepatitis, as I've said, is a public health issue worldwide. However, we are going to focus squarely on what it does for Nigeria, or for instance in sub-Saharan Africa. This infection poses a lot of serious health challenges, especially because it can lead to a chronic condition. And when it's a chronic condition, it might become a bit more difficult to maintain or manage. So today we're going to focus squarely on viral hepatitis, specifically hepatitis B and hepatitis C. Starting with hepatitis B. Hepatitis B is actually the most common type of viral hepatitis in Nigeria. Its infection is very rampant among the youth as of right now. And most of the time, a lot of people do not know that they have hepatitis B until a very crucial thing is about to happen, maybe if they want to donate blood or if they are pregnant. So we have to understand that we at Seco Direct always want to provide a case where people that listen to us are proactive in the management or in getting ahead of these infections or these inflammations, as the case may be. Now, when a patient has viral hepatitis, with hepatitis B being the source infection, what we need to understand is that our body has some antibodies that would fight against this hepatitis. Now, it could be acute hepatitis, which can be reversible in the sense of we can have our antibodies attack this virus, and after about 1 month, if you recheck, we notice that this viral load has been reduced, or even you notice that the body has developed antibodies to this hepatitis B virus. But then we also have, if that does not occur, that is when we see the progression into chronic hepatitis B. So when we talk about chronic hepatitis B, like I've said before, it is a long lasting or long life infection, and Even though I'm saying it in this way, it is not the end of the world, even if you've contracted this particular virus. Your chance of having or developing chronic hepatitis B is greater if you were infected by this virus at a younger age. If you're infected in your 20s, 30s, there is a possibility of it being reducible or manageable to the point of where you actually have a low viral load to exist normally or without, once you have been through management, of course, over a period of time, being able to actually have antibodies and not have hepatitis B anymore. But it is very progressible to chronic if you contacted this at an earlier age, especially from age 1 to 5. They usually develop chronic infections. 25%, 20 to 50, 25 to 50% of children usually develop chronic infections. Now, when it comes to hepatitis B, how can it be transmitted? Hepatitis B is transmitted through contact with fluids of an infected person, either fluids like blood, fluids like semen, vaginal fluids also. That is why the crucial way of when this virus is admissible is through blood transfusion, mother to child transmission, which is during birth, through unprotected sexual contact with an infected person, sharing personal items like blade, things that can use to cut yourselves. If you're sharing those kind of personal items, you have to be more careful because that is a way to which hepatitis B can be transmitted. What can we do to prevent having hepatitis B? As I've said before, if you look at what causes or what actually happens when it is transmitted or how it can be transmitted from person to person, the way it can be prevented is simplistic. Now, if we say can be transmitted from mother to child, how can it not be transmitted? Now, if the mother is transparent with the fact that she has hepatitis B virus and it is detected during pregnancy, the baby can be given hepatitis B immunoglobulin. And even if the child takes the breast milk of the mother, there is no threat of transmission between the mother to the child. What else? Unprotected sexual contact with an infected person. But in the terms of marriages or committed relationships where sexual contact is a given, always contact your healthcare provider as to how you can manage, be there for your spouse, and how you can still perform that function with each other without jeopardizing yourself. One thing you can do, of course, is to get the hepatitis B vaccine. That is, if you are the spouse of someone that's been infected, you can get the hepatitis B vaccine. You can make sure that you be that standing pillar for them as they go to the hospital or meet with the practitioner that would help them with the management plan that will be required for them for long life if it is chronic hepatitis, or for a period of months if it is acute hepatitis B infection. Another thing is, please do not share sharp items with anybody. For men, clippers, get your own clippers. For women, blades, any shaving sticks, anything that has to do with inflicting or causing or cutting, please do not share with anyone else. You must always have your own set of tools, number one. Two, when you use them, make sure that you sterilize them. Before you even use them, make sure that you sterilize them, because there are instances that I've heard of where people would use sharp tools of other people and will not even clean it properly and keep it back. So you always have to get ahead of things like this. One, you have to go and clean it yourself, because you never know if that kind of thing can happen to you. Now, having contact with open sores of an infected person too can be something that can cause it. For instance, in the healthcare sector, with nurses and doctors, in terms of administering medication, collecting blood samples from a patient, you have to understand that we as medical practitioners have to be very careful, because you do not want to be in a position where in the midst of providing care for your patient, you get infected with something and start feeling bad that by accessing yourself to healthcare or doing something that was supposed to be beneficial for someone, you got yourself into something that is difficult to handle at that moment. Now, what are the things that you need to do? As a medical practitioner, you also have to make sure that you wear your gloves. You make sure that if it has anything to do with blood, it does not touch you directly. It has to go through your gloves. It has to touch your gloves. You can double glove too if need be. Another thing is when you're also using all these tools, sharp tools, your needles, if you have used the needle to take blood from a patient that is infected with hepatitis B, make sure to discard appropriately. There are a lot of sharp boxes either beside the bedside of the patient or even outside of the ward where you can dispose properly. If, for example, a lot of doctors are aware of what is called setting a line for a patient. Nurses too aware of setting a line for a patient. Now, if you set a line for a patient, which is to put an instrument into the vessel of the patient to administer drugs and medications, you must always understand that there are proper ways, there are steps that you need to go through to make sure that every single thing is at its least risk for you and as well as for the patient. And also, another very niche thing that will probably be for the medical practitioners, in the cases of surgeries that need to be performed on infected persons that have hepatitis B, there are also precautions that need to be taken. For instance, you can wear goggles, you can double glove, you can make sure that your overall gown, your surgical gown, covers all parts of your body. Now, with that being said, in terms of prevention of hepatitis B, you can't get hepatitis B from another person if you are being coughed on or sneezed at by the person, if you drink unclean water, if you hug the infected person, shake hands, hold hands. Those things will not cause you to have hepatitis B. Yes, we are talking about having prevention or making sure that you prevent yourself from getting it, but we do not want to get to the point where it becomes having stigma against infected persons. You can share spoons, share forks. You can even sit next to an infected person. You can hug, hold hands, walk around. All these things are very safe for you. Please do not stigmatize people that you are aware of them having hepatitis B virus. Also, as a spouse of a person that you know has hepatitis B infection, you have to understand that you are committed to their recovery or to their management of said hepatitis B virus. So you have to also be informed of all these things that we have said and make sure you do it in a way where your spouse is well accommodated and well adjusted to the new lifestyle that they want to be living. So when we're talking about hepatitis B virus and want to go about complications, it can progress to things where, when we say your liver is inflamed, now when your liver is inflamed, it can get to a point where it becomes a fibrous tissue. When you keep on injuring a particular part of your body, after a while you see these hard crocks on your hand. They had sort of feeling on your hand, like black. Sometimes it's black. If you've had an injury before, you can see these black formations. That's usually platelets that help to heal clot formation. Proceed with clot formation in healing of wounds. Now, when it is your liver, it can become something called cirrhosis, a liver cirrhosis or a liver fibrosis, for instance. And also, it can lead to another complication called liver cancer. We're going now to hepatitis C. Now, when we say hepatitis C, it is also a prevalent infection with similar mode of transmission as hepatitis B virus. So hepatitis C virus is another prevalent type of infection in our region. Now, it's less common than hepatitis B. It's actually way less common than hepatitis B in our community, and is primarily spread through blood-to-blood contact. When I say blood-to-blood contact, it includes sharing of needles, unsafe medical practices which we have gone through already. One thing that some unscrupulous hospitals could do is using non-sterile medical equipment on a patient. Please make sure as a person, when you go to different hospitals, this is why it is very paramount for you to understand what is standard in a hospital and what is not. So when you get to a hospital, you have to understand that, okay, this is what I want. If they have used something for you, request for them to use a brand new instrument for you. If it's a needle they had used previously for you, it does not matter. You can tell them, can you use a different needle, please? All these things are precautions that need to be taken. Blood transfusions too. You can ask, like, this blood transfusion, please, can it be from someone that someone from my family that can help donate the blood? That can be granted to you. You have your rights as a person in a hospital to make sure that you dictate what is best for you at a hospital gathering. Because in hepatitis C, an infected blood changes a whole lot for you. Because hepatitis B might have a possibility of being reversible, but hepatitis C has none of that. Hepatitis C is a chronic progressing condition. So you have to be very, very careful. What symptoms usually come about when it comes to hepatitis C? Now, hepatitis C's symptoms can vary from mild to severe. Mild like fever, fatigue, jaundice. When you say jaundice, I mean yellowing of the eyes and yellowing of the skin. You can also get things like abdominal pain, nausea, vomiting. But for people, they might not show symptoms of liver damage in terms of hepatitis B or even hepatitis C until it is too late, where you can see things where they are vomiting blood, which is signs of things like portal hypertension. There is a vein or artery that is connected to your liver, where if it is expanded and it increases blood flow to your liver, causing what is called a portal hypertension. I've spoken about the social stigma that occurs with hepatitis B, and even hepatitis C, which can lead to discrimination all about. Please, and please, do not stigmatize anyone that you are aware has these conditions, especially because they were even forthcoming or transparent enough to inform you of this condition. That is, they are even in the process trying to protect you from them or let you know that, okay, this is what they have. Them telling you is not for you to use it as a weapon against them, but rather to comfort them and be the best person you can be for them. Like I've said again, preventing hepatitis is very crucial to making sure that this progression, this epidemic as it may be, of hepatitis B in our society reduces. Things like vaccination, hepatitis B vaccines are very readily available at different healthcare providers. You can make inquiries and get the hepatitis B vaccine. It is usually in 3 stages over a period of 6 to 9 months. Safe medical practices, I've spoken about this in length, making sure that things are done in the proper and standard way in terms of healthcare that is provided to you, in terms of things that are invasive to your body. You must make sure that healthcare providers are service to you, not that they are acting like you are at their mercy. Also, avoiding risky behavior. Be risk averse. When I say risky behavior, that is, if you unprotected sexual intercourse, for instance, it is not paramount that you have that. Please be protected at all times. Do not also share needles. Oh, that's my guy, I want to share clipper with him. No, you have to understand, it is not only good for you, it is good for that your guy too, to understand that both of you having needles separately is the best thing for both of you. And also have good hygiene and good habits, safe practices. I've also spoken about how people use blades and just mess up everywhere and don't clean them. You have to understand that you must have good habits regarding what is yours and what is in your own space. Public awareness and education is also really important, making sure that people understand that these viral hepatitis, these viruses can be managed. You can also tell them what can happen if they are not managed properly. And you can tell them that it is not the end of the world. You can just make sure that they understand that it's a social gathering. There are also things like having a gathering of people that have it, that have been able to conquer it, do seminars to let people understand their own pathway to recovery, their own pathway to management of this condition, and making sure to understand that you are not alone in this. Now, regular screening also and early treatment is fine. Like I said before, acute hepatitis B, for instance, is reversible. Even some chronics, in terms of some things that have been said, have been known to be reversible in terms of long-term reversibility in when your body finally gets the antibodies to take it away. Access to treatment also is good in terms of ensuring you take the right antiviral medications for this particular condition. Before I go into my roundup, there's one thing I want to say. When it comes to investigations of hepatitis B and a positive hepatitis B blood test, you can always do what is called an hepatitis B or hepatitis C full scan, a full panel, just to understand where you are at in terms of your viral load, where your antibodies are, what antigens do you actually have in your body as of right now. And also make sure you go to the appropriate healthcare provider. Typically in Nigeria, a gastroenterologist is usually who handles hepatitis B or viral hepatitis because of the liver affection, because the liver is part of your stomach. So a gastroenterologist also helps. When I say stomach, I don't mean your stomach itself, but it's part of here, your midline. So you'll need to understand that if you are in charge of how you want to control or how you want to treat this particular virus, this hepatitis, it's better for your health, it's better for your mental health, because you know where you are coming from, where you are going, and how things are progressing from time to time. So these panels, you can usually do them over a period of monthly, you can do them monthly. Some people, they can do it over a period of 6 months, and after 6 months they notice that the antigens that they normally have are no longer there. The antibodies in their body have been able to take over and control the virus. Thank you very much for joining us for this episode. If you have any questions, please don't hesitate to go to the comments below and let us know. We'll get to them and make sure that we go around to answering any questions or any fears that you might have about this virus and about its progression and about some symptoms that you might have seen. Until next episode, my name is Dr. Tiwa, and I'll see you again.